Hi, it's Jacqueline DuPont again. I'm here on the second part of our series to talk about what are the red flags when you're touring facilities for your loved one, when you're looking around and really trying to contemplate, is it the right time, and could my loved one really enjoy assisted living or skilled nursing? The first thing I always like to talk about are red flags, not just the typical, does it smell? Smell, of course, odor is a big concern because it shows bacteria, it shows dignity, it shows a lot, but odor isn't the only thing you want to look at. When you walk in, you really want to make sure you don't just see a hotel. What is a hotel? A hotel can be just pretty, it can have a whole bunch of rooms, long hallways, and it can have everyone in their room. So we really don't want that. We want to look at, are people engaging? Are there group settings where older adults are having fun? Are they playing bingo? Are they listening to music? Are they watching a movie? Are they on a walk? Are they doing exercise? Are they performing in any sort of way with art? The arts are really critical. And really, do you see any friendships? Do you see anyone bonding? A key in assisted living is having different levels of therapeutic programming. Having a, for example, mild group that's more active and very, very little cognitive impairment. They're maybe doing bridge or bingo, and then a moderate group that's watching a movie, that's a beautiful scenery movie. Maybe it's taking them through the Midwest, something really nice with nature in it. That would help a moderate group that really is a little bit more agitated with memory loss or not able to bond as well. But they're in that group. And then a late stage group that might be getting a massage, might be listening to music, might be doing some tactile stimulation, or maybe just really getting some great care. You see them in a group setting though. Seeing them all in their bedroom isn't a good sign. Another thing to look at is, are there staff around? They're going to give you a ratio. Everyone gives a ratio. Is it 1 to 5? Is it 1 to 8? Do they count the med tech? Do they count the nurse? Who are they counting? The critical thing is to look around. Do you see a lot of staff? If the staff are there, if you see caregivers, if you see med techs, if you see nurses, you probably are seeing an excellent facility. If you don't see anyone, there's a problem. You again don't want to see older adults left alone, and you want to see interaction from the staff. You also want to look at the dining program. When you're in the dining program, you're touring the dining room, make sure it's appropriate. Is there a seating arrangement? What does the food look like? Is the food being served properly? Is there a long wait time? Does the food seem cold or warm? Whether you're going to have the food or not may not be an issue, but really take a look around. Another issue we all like to look at is the medical program. In assisted living in California, for example, it's not very medical. It's non-medical. Why is it non-medical? Well, I think there's a lot of liability in offering medical services. So a lot of owners have shied away from any kind of medical care. Although older adults with memory loss have medical issues. So you want to make sure, do they have a physician on staff? How often do they visit? Do they have a psychiatrist? Do they have a psychologist? What kind of medical care do they offer? Is it just home health coming in, or do they actually have a nurse? If they have a nurse, what does she do? Do they have any kind of way to dip urine to check for urinary tract infections, or do they just send them to the hospital? How does this program work? And getting those kind of details are really critical. In regard to caregiving, you want to know, how often are showers offered? And is there an extra charge for more showering, or what is that issue with showering? Because showering is critical. Cleanliness and hygiene are really, really important with older adults with memory loss. So don't skip over that. Take some time to ask some questions about the ownership. Is it family owned, corporate owned? How large are they? And how often does the corporation visit? Those kind of issues are really critical, especially when you have issues, like everyone's going to have, small complaints, large complaints. How do they get resolved? So those are the tips for looking. And red flags, really, again, you don't want to see a hotel, you want to see a home, a place where your loved one can really enjoy their last days. And so many people say the last days were the best, especially when they moved into a place they really loved.